Good morning, welcome back. This is Dr. DuPéré in Toronto. I have this lovely lady with me today who I thank gracefully for agreeing to this filming. We are doing a facial rejuvenation procedure today. We're going to do multiple procedures and I want to show you a little bit what this procedure will entail. First of all, I'm going to start with some fat grafting. We are a little bit hollowed here, a bit, lots of shadow. She's got high cheeks, which are her best friends for a long time for youthfulness. But I'm going to put a little bit of fat here to help to pull this up a little bit. We're going to do fat in the nasolabial or laugh line, the marionette, and the pre-jaw depression. So that's going to be my number one. I like to do fat grafting first because it requires the most artistic component of the procedure, and the fat is put right on bone. It will not affect the facelift planes that we're going to do after. I'm going to follow with an upper lid surgery. She has very nice high eyebrows, so most of her issues are in the upper lid itself. She's had a procedure many years ago, so we're going to follow the old scar, remove more skin and some fat pads that are still present. Then I'm going to follow with a classic plastic surgery, aesthetic neck lift and facelift. You can see here, we're going to say E. We have a band here that's detached and the other band will be somewhere around here. So I'm going to do a tiny bit of liposuction, small incision, and I will reattach the two bands together so that when I do the classic facelift, a deep plane facelift today we're doing, I'm going to be able to grab this muscle and attach it, anchor it to strong structure behind the ear, behind the lobe, and the muscle layer of the face. So the muscle layers here are all called SMAS, and I'm going to anchor in 3 spots this deep layer. So the deep plane facelift refers to a plane below the muscles of facial animation, and then we're going to lift the skin as a separate plane, but somewhat less undermined that we used to do 15-20 years ago. And we're going to complete this procedure with laser resurfacing. My best friend is the halo laser. It's important for texture. For those fine lines that we have here, a facelift will not help. We call them crepey, like the fabric crepe. And those lines can only be improved with laser. Laser will help with her larger pores. She's fortunate, she doesn't have a lot of hyperpigmentation. I see a few lesions here, so we'll treat that as well. But the halo today will be for texture, large pores, and her fine wrinkles. It is a longish procedure, so I keep all my patients overnight. We'll take very good care of her. And I'm hoping to show you some progress throughout the day and in the follow-up. Welcome back. This is part 2. I just completed the fat grafting on Our Lady today. It is a facelift deep plane technique I'm doing today, but fat grafting is an important component of most of my facelift. This lady had high cheekbones, I showed you earlier, so we're not transforming her today into something she was never before. She did have cheekbones, but there was some loss of volume from aging. She had a deep shadow in the laugh line. So I started, like I start all the time, I do a correction of where I want it to be, and then I will double up the amount of fat because about 50% of the fat will die. Now, I've recreated what I feel a cheek implant would do. And again, it's doubled up of what I like. She doesn't want to look unnatural. So I think this is a beautiful, I put 7 ml of fat here. I put 4 in her nasolabial fold, the laugh line. You can see now it's nice and soft. Marionette line has also been filled, and the pre-jaw depression here. And when I'm going to do the facelift later today, it's going to be gorgeous. Fat grafting, again, is a very important procedure that's combined often with facelift. Sometimes I do it for rejuvenation purposes only, like this young lady. She wants to look supernatural and not pulled and not done. She had high cheekbones, so we did not need to give her more cheeks. There are patients who come for cheek augmentation, patients who come for facelift who have no cheek projection. Then I will do both rejuvenation and augmentation. Hello, this is part 3. I want to show you, I've done the dissection of the deep plane facelift. I've re-anchored the deep plane muscle layer called the SMAS. And I want to show you inside under the cheek. So it's a surgical dissection. I will show you where the SMAS gets anchored in a lower facelift. And I will show you the excess of skin I was able to recruit that I will be removing and sewing with minimal tension. The neck has been done. The other side has not been done yet. So you're going to see also how, even though we're not finished, how much this angle here is done. You can look at this, and I have not pulled on the other side. Just doing a platysmoplasty, liposuction on the neck, some deep tissue removal. This is the amount of skin I'm going to have to remove. That's very impressive. And now inside, I've done already the SMAS. So you're going to see the SMAS here. The muscle has been re-anchored to the back. So this is the muscle of the neck. And the muscle of the cheek has been anchored right here to give her this lifted look. The skin is carried by the muscle, so we don't have to pull too hard on the skin. And the goal for a very good scar is to allow the muscle to bear the tension, but the skin to be tailored around the ear without tension, so that we get a very good scar. So this is part 3. The left side has been lifted. The SMAS, or the deep plane layer, has been anchored. Now I'm going to tailor the skin to the ear, and I'm going to go on the other side. Hello, welcome back. This is part 4 of our facial rejuvenation procedure today. We've completed the neck lift and facelift. You can see how sharp this neck angle I was able to give her. There is a drain here, so if you see a little bit of unevenness, it's a little drain that I like to use with our facelift. Just for 12 hours, it gets removed before she goes home tomorrow. You can see the nice incision. She had a little skin lesion in SK, seborrheic keratosis. I shaved, and this is a nice incision. Part of it is hidden in the ear canal, around the earlobe. Very important to give a normal shape of her earlobe. She had an aged earlobe, deflated, so I trimmed it a bit to create a nice, younger looking earlobe. And we have our incision in the back here. And what I want to draw attention to is really that crisp neck angle that I was able to provide her. The corner of the mouth has been lifted in a natural way. There are no windswept, unusual lines that we see sometimes when the skin is sewed with too much tension. Now those little stab incisions are from our fat grafting that we've done at the beginning of the procedure. We did our upper lid surgery. My corneal protectors are inside. Looks a bit funny, but I'm about to start the laser, and it's always important to protect the eyes.